Recording. So welcome everyone. Thanks for joining us on a sunny afternoon. I am excited to be able to share the responses to our survey that we did this year. I do want to just have a caveat out there that we extended the date that we kept it open. And so this has been crunched together in about a week. So we will be coming up with additional insights as we do more number crunching. But I just wanted to say that we wanted to get information out to you as soon as we can, with the recognition that as we do some more slicing and dicing, we'll be able to give some more in-depth analysis. But there's some pretty strong storylines that are evident just from an initial analysis. And so happy to share those with you today. As you know, a year ago, GCRI partnered together with FIO partners who did a pro bono support of a survey and report last year. And that information and data was really helpful for us. It was about 6 months into the pandemic, and it was a really helpful snapshot for us of kind of where organizations were at that time. At that time, none of us realized we were still going to be in the midst of the pandemic a year later, but obviously we are, and there's question marks about the Delta variant and how that's going to affect things moving forward, which was definitely front of mind for survey respondents this time. The uncertainty about being able to plan and to being able to know when are things going to be non-pandemic like. I won't say normal, but non-pandemic like. So that is a factor in understanding some of this data too. I'm going to go ahead and share my screen. So the survey was done as a partnership between GCRI and United Way, but we had a lot of partners in the process. So I want to say a big shout out to Rhode Island Foundation, GCRI, and United Way for providing gift cards that we used. Respondents were put into a raffle for gift cards. And so I want to say thank you to those donors for that. Also, we had partners who helped distribute the survey. So thank you to Blue Cross, Centerville, Champlin, City of Providence, GCRI, obviously, Rhode Island Council for the Humanities, the Department of Health, Rhode Island Foundation, State Council on the Arts, Tufts Health Plan Foundation, United Way, and Van Buren, and others of you who shared it that I didn't even know about. Thank you. We got a really good response to our request, and so I think that we can confidently say that we have a significant portion of the active nonprofits in the state. There's about 3,400 nonprofits that are listed, charitable nonprofits that are listed with the Secretary of State's office, and we had about 330 responses. So that's about 10% of the total number of nonprofits that are registered with the state, and some of those nonprofits are not very active. And so that's really significant. So I want to say thank you to all of you who helped make that possible. So Adama and I are tag teaming this, and just again want to say that this is our first run through on this. We will be looking at some more in-depth analysis moving forward that we'll be sharing at the funder briefings coming up, but wanted to give you an overview. I also wanted to ask your forgiveness for typographical things or graphical things on here. We are trying to get it out as quickly as possible, and so those changes will be made before we distribute it publicly. So with that, I want to say thank you to Adama for all of her number crunching and pass it to her to talk about the methodology of the survey.
All right, thanks, Nancy. So just want to give y'all just a kind of overview of those who participated in the survey. We had 292 distinct organizations who we received surveys from, and there were a total of 330 participants. If you're wondering why that number doesn't equal to 330, there were some people who did not tell us which organization they were with. But nevertheless, we were able to determine that there were 292 distinct actual organizations that were represented. In terms of the location where the organizations and the participants were located, 44.5% were from Providence, another 6.5% from Newport, 6.1% from Warwick, and others from Pawtucket and East Providence. And then the other percentage that I didn't show here was basically all over the state. But these are the primary locations. Next slide, please. And so this slide looks at the percentage of paid staff members. And as you can see that about 31% had staff members, 1 to 5 paid staff members, followed by 24% had 6 to 20 paid staff members. And then you had 16%, a little over 16%, who were led primarily by volunteers. Next slide. And so in terms of the primary focus of the organizations, these are pretty much like the top 5. Could you go back to the next slide? Oh, thanks. These are primarily like the top 5 focus areas for the organizations. We had 29.8% of the participants represented arts, culture, and humanities, followed by education. And then we had another 12.5% representing social services or behavioral health, another 9% representing basic needs, and then 22 or 7.6% primary focus of the organization was health. And this slide represents the annual budget. You can see that for a little over a third of the participants, they had budgets of over $1 million, followed by those who had budgets between $250,000 to $500,000, representing 14.5%. And then there was another 13.89%, almost 14%, who were under 50,000 in terms of budget. And then you can see how the remainder played out. Primarily all the participants, as you can see, almost 70% were CEOs or executive directors, followed by those who were in some type of management or team membership type function. One of the things that we're really interested in is BIPOC leadership in the nonprofit sector. And I apologize if the numbers might seem kind of small here, but basically the big picture is, in terms of leadership, those who participated, their organizations are not basically led by Black, Indigenous, persons of color. If we look at those whose majority of their staff were represented by BIPOC leadership or BIPOC persons, we have like 24.5% represented by BIPOC leadership, but for the majority of the leadership in the nonprofits that we surveyed, that participated in the survey, not led by BIPOC individuals.
We are going to, one of our slicing and dicing analysis is going to be pulling out the BIPOC organizations to look at specifically how the pandemic affected them. Some of the big picture takeaways, just so that you can kind of set the table for this, is that the pandemic, number one, is not over, both for the communities and the organizations that serve them. And it has been costly, both in terms of financial cost as well as the toll it is taking on the staff of the organizations. That is the overwhelming message, if you take nothing else away, is that this isn't a sector whose staff are burning out and considering leaving the sector, which is really alarming. There are tremendous resource gaps obviously needed, and and racial equity is still front of mind for leaders as they're looking forward. The first message is that the pandemic, for people who are going back to work in a white collar office, may seem like it is dissipating, but the communities that we work with, the organizations work with, are still in crisis. They are lacking basic needs, particularly as government benefits end. The cliff that we're facing right now. Housing, it's a tremendous need, and I didn't have time to find a housing icon, so you have a blank circle there. There's an eviction crisis and a lack of affordable units. Public and mental health, the stress of the last 18 months, as well as isolation, lack of engagement, is really taking a toll. And then learning loss and family trauma in education.
Get a further sense of some of the challenges that communities are facing. We asked the question, to what extent do you believe your clients or participants are experiencing the following as a result of the pandemic? And as you can see, in terms of those who said slightly more to significantly more, health issues was the big one, followed by post-traumatic stress and toxic stress, as well as mental health issues. So these were the four big issues that participants saw their clients actually experiencing as a result of the pandemic. We also asked a question, as emergency government relief programs come to an end, do you believe that demand for your service and programs will increase, decrease, remain the same? And overall, we have 59% saying that they believe the demand for their services and programs will increase as emergency government relief programs come to an end. We also asked a question about whether or not what particular communities or populations that our partners serve that they fear may be overlooked during the next year. And low-income families, as well as Black, Indigenous persons of color, youth, and older adults are the ones that there was concern that in this next year, those communities or populations would be overlooked.
One of the striking components of the qualitative responses that we saw was this accumulating loss and stress. And so this one leader said, what I am seeing right now is a collective burnout, meaning the emotional and mental health of our families and community organizations is not well. The past 2 years have taken a huge toll on all of us, particularly BIPOC communities, and there's been nothing done to address the trauma and loss we have experienced in a communal way. It's hard to ask people to show up to meetings, to come to testify in an issue that matters when they are burnout and hopeless. We need communal healing. And one of the reasons that was identified for that sense is that for some parts of our state, some constituency groups, this is just an ongoing trauma. So this is not new for the pandemic, but particularly Black and Brown communities are, this is a multiplicative factor versus a new experience. This is just multiplying their stress that they have been facing. So the many of the individuals who we support in the immigrant Black, Brown community present with a myriad of culturally related needs that are driven by poverty, trauma, and being undocumented. The organization has seen the need for resources at a heightened level since the pandemic, with no signs of subsiding. The sense was that there has been no change in alleviating the basic needs support. One organization said a 300% increase in need for our services. So when we asked what their pressing needs were, they said everything is pressing because there's such a demand for the services. SNAP benefits had expanded, and they are going to return to their previous levels. So food security is an issue. The conditions have not changed. The one on the side, our communities have always struggled for basics like housing, job, employment, fair education, and health. The pandemic only made that worse, on top of an increase of other forms of state violence, such as policing and abuse of our community members. The temporary relief is ending, so the temporary supports provided by the government, but the conditions have not changed. And low-income communities were already struggling pre-pandemic, and they fell further into poverty during the pandemic. Nonprofit organizations who have services for these communities have further depleted their resources and their finances during the pandemic to make sure that everyone got what they needed. The housing crisis is especially significant with the end of the moratorium. As many of you know, the state has received $200 million in rental assistance, but a very small portion has gone out. Christina, I'm sure, knows the up-to-date, but the last I heard is 15 million of that has gone out. Hopefully that's, I think it was up to 30 or 40 now. But that is $150 million that are available, but not distributed. The need for emergency shelter, rent relief, and housing have risen exponentially. People are having difficulty accessing the rent relief program. There are hundreds of people unhoused, far more than are reported, as there are hundreds more who are couch surfing, which does not meet the federal guidelines for homelessness. But it doesn't constitute an adequate living situation. There are many people, including families with children, living in cars. The shelter system is overwhelmed. The other issue is that there are not enough affordable housing units. So once these families are displaced, there is no place for them to find, even if they do get additional resources, they are unlikely to find permanent housing options because there are just not enough units out there. Obviously, there's a public health crisis. This was a health-related nonprofit who said their patient volume increased by more than 200% in 2020. New patients have increased nearly 50% compared to the same time frame in 2020. Mental health and addiction were also identified. Rates of depression, anxiety, substance use, and suicidal ideation have increased by 20%. There's a Narcan shortage nationally, and it is in Rhode Island. Any of you who want to make a difference in that space, we can connect you with the organizations that are looking for a Narcan. But there's also a tremendous surge in the need for mental health and substance use treatment. Also, their reporting is down on mental health and child maltreatment because of the remote schooling and a limit on preventative care visits. And so when both of those systems are reopening now, they're expecting an increase in reporting on that as well. And then many of the education providers talked about how the children are going to be returning to the classroom with trauma, and they are expecting a multi-year recovery as students return to the classroom. So in the midst of all of that need, these nonprofits have stepped up to provide services. So we asked them some questions about their actual service. The first section is kind of laying the land, what the environment looks like in the communities, and the existence of a lot of needs that have not changed or have been exacerbated by the pandemic. And then we will spend some time talking about the programming that's been offered.
So we asked participants at this stage of the pandemic, to what extent are you currently delivering your normal programs and or services? And 41% are currently delivering them at moderate rate, whereas there are others, 25.2%, who are delivering programs or services to a greater extent than they were before. And there's 17.9% or almost 18% who are delivering services similar to what they did before. Next slide. We also asked if they've created or started any new programs during the pandemic that they will continue after the pandemic ends. And three quarters said that yes, they definitely will continue programs that they started during the pandemic. We also asked if they have permanently canceled or eliminated any programs or services as a result of the pandemic. And 73% said no, and about 26% said yes. This slide asks what they anticipate after that the pandemic ends. I'm sorry, I'm having a hard time reading this slide here. It's a little fuzzy to me.
I can do it.
Yeah.
Oops, sorry. The vast majority of organizations said that they are planning to, once the pandemic ends, to have a hybrid of programming, offered both in person and virtually. So 63%, so 2/3, are planning on continuing to do offer both virtual and in person. And about 60% said that they planned on their staffing continuing to be a combination of working in the office and working from home. For most of when you saw the question about permanently canceling programs, most of them fell under this category of the first quote, well, permanently, quote unquote, as in until it's safe. So many of them interpreted that as canceling maybe a season of something or the school year of a program, but that they plan on resuming those programs once it is safe to do so. So even when you're looking at kind of what the organizations have on their plate, they haven't really said, well, we're no longer going to do X, Y, and Z. It was more, we're putting on hold X, Y, and Z, and then we're going to add it back into our plate once the pandemic ends. There were, particularly in the arts community, there were a lot of cancellations of concert series or programs because of the pandemic. A lot of other types of organizations, when they talked about their new programs, many of them, it was a different kind of delivery of their programs. So doing virtual programming versus in-person programming, doing curbside pickup for a food pantry versus doing it in person. But there were actual new programs as well. There is still a lot of uncertainty about next steps, but there was an effort to point out that while this transition and innovation had happened, it was not without a cost, that programming is not in person for the time being, and while people outside of our community have greater access, so a lot of organizations talked about now more people can take advantage of our programming. So say an arts organization may be able to reach someone in Montana because they can log into the live stream. Those locally without the technology and skills and resources are at a loss to access that programming that they used to access in person. Another provider said we have drastically had to change the nature and format of our programming in such ways that we're unable to accurately communicate anticipated impact to funders. So that is something to keep in mind as funders, that it's one thing to be able to count the heads that are in your classroom for an after school program. But if you are providing a live stream or recorded content, it may not be as easy to document the impact that you're having on an audience. And also some of these innovations also incurred additional costs. So the last comment is they reduced their audience size by 75% because of the COVID restrictions and presenting things online, which gave access to a wider audience, but it also added significantly to the overall expenses. So when we asked them, understanding that they are pretty much all up and running, some to a somewhat lesser extent, some to a greater extent. But when we asked them what their pressing challenges were for leaders as well as just their organizational perspective, there was the number one issue is staffing. Burnout and staff retention, hiring and recruitment, inadequate staffing levels are taking a toll across the sector. Finances are really significant, and a lot of fear with the end of relief funds moving forward, as well as increased demands for services. Racial equity, which we'll talk more about all of these, and then board and volunteers, engaging the board, recruiting board members and volunteers, and safety for all staff.
So this next question we asked, what are the pressing challenges your organization faces at this time? As you can see here, financial and organizational capacity and staffing are like the three big ones that are really pressing challenges at this time for the organizations who participated in this study. Can we go back to the next slide? Oh, in terms of staffing, there were really kind of like four kind of thematic areas around staffing that the survey covered. One was around recruitment, retention, and pay scale, staff burnout, continued community need, as well as board recruitment and engagement. We asked to what degree the staff is experiencing any of these following as a result of the pandemic. And as you can see, emotional exhaustion, burnout, physical exhaustion, compassion fatigue are real for these organizations, with percentages ranging from 73% to 86% saying that this is something that either some staff or most staff or all staff are experiencing at this time.
And one thing I wanted to highlight as well is the final three. While the overall percentage isn't as high as the emotional exhaustion and burnout, the fact that 40% of organizations said that they have at least some staff who are contemplating leaving the sector is enormous. And 30% have at least some staff who have already left the sector. and 27% have pursued a less stressful position in the nonprofit sector. So when we think about the upcoming need because of the benefit cliff, and combine that with the fact that we have almost half of the organizations who have staff who are contemplating not only just leaving their job at that organization, but leaving the sector as a whole, that potential loss of institutional knowledge and skill, particularly at the same time, combined with the issues that people are having with hiring and recruitment, means that we could be facing an even bigger crisis in the sector. With the staffing issues, there were 55% who said that they were having issues with hiring and recruitment. So you have over half of the organizations who are having trouble getting adequate staffing levels at the same time that you have 38% have staff who are contemplating leaving the sector. So I think red lights on the dashboard, alarms going off about the significance of the staffing issues in the sector. Everyone is burned out. People are leaving their jobs and there are no new people applying. Staff are stressed and have competing family issues that affect their ability to work. In my 45 years leading organizations, I have never seen such widespread stress, dissatisfaction, and diminished resiliency that is almost impossible to penetrate. The fatigue that is accompanying the ongoing continuous onslaught of challenges in year 2 of the pandemic are not just the limited operating environment, it's the lack of qualified staff, the starting and stopping of funding opportunities. There's not enough capacity to respond to all the challenges at the same time with the ongoing uncertainty, and too many selfish individuals have now prolonged this pandemic because they are selfish. Oh, I have you on a different slide than I'm on. Sorry about that. That was the previous slide. Okay. In terms of hiring and retention, there was an ongoing chorus about the lack of high wages, particularly as the private sector or places like Lifespan right now are offering a $20,000 sign-on bonus for the same types of positions that maybe nonprofits are trying to offer. Recruiting competent staff and maintaining staff in an environment where large corporations are paying almost 45% more in wages than nonprofits. And the whole idea of succession. So you have just the aging of the leadership, the generational change, and then you also have the toll that the pandemic is taking on the current workforce. So when we're talking about well-being, giving staff who have not stopped during the pandemic time to recuperate, cope, and recover while moving business forward to rebuild capacity, people are just worn out. Some are seeing that that's resulting in more serious personnel issues because people are just stressed out. Fatigue and PSD are real in our sector. Many are considered first responders and provide critical basic needs while living paycheck to paycheck themselves. As we enter the 3rd year of the pandemic, the biggest leadership challenge is me leading a staff that is burned out and emotionally spent. We have focused so much on keeping our kids emotionally and physically safe, but the toll has been enormous on our staff. Organizationally, we have instituted a number of programs, including financial incentives for staff wellness to try and help, but at the end of the day, I can't give folks what they need, which is a true break from the stress. The compassion fatigue felt by staff as a direct result of inadequate response by state leadership to address immediate resources for those experiencing homelessness feels hopeless. I think the pandemic has brought to light a lot of issues of labor versus management in general, and especially in the nonprofit sector. I think our staff is growing somewhat restive. Everyone feels uncompensated, and it's hard to know who needs attention first, seasoned senior staff or up and coming younger staff. I wish there were more models for predictable pay equity in the nonprofit world. And a lot of this stress is inevitably falling on the executive directors. Um, in addition to the constant stress of living through a pandemic, I've been dealing almost single-handedly with the financial stress on our organization and our loss of program revenue. I've also been a source of support for my staff. Having to keep it all together and put a brave face on for everyone has been exhausting. I'm exhausted too. I need a break and have had a hard time modeling good personal practice, going months at a time without a break and answering emails and calls at all hours. It seems endless in a new way. Let's see, isolation and loss of connection and feedback. So when you're looking at the remote working, there's some great things about it, but for safety and efficiency, but I don't see and hear from program beneficiaries. The staff also doesn't have a direct line to leadership and it's caused some tension. Like most, we're experiencing loss, fear, and stress on a daily basis. One of the things you may think about is how we can build the capacity for staff. And the issue with professional development is that staff members feel they can't take the time to enjoy or benefit from courses when the overwhelming workload looms. Something like employee benefits, gift cards to restaurants or spa days or grocery stores, or free yoga classes we could distribute from a capacity building employee grant program might be helpful. Training on trauma-informed care and facilitation. Mindfulness-based stress reduction. I would drop everything to go to this workshop. Mental health best practices for managers supervising staff during collective trauma. If anyone wants to take that as an easy lift, I will host the workshop if you want to pay for someone to come in and do that on a large scale. It is going to be critically important to address the stress and burnout among staff members. The board side of things is also an issue. A number of organizations said that they have struggled to keep their board engaged because the board members are dealing with their own issues. It's difficult to train them. So there's a list of training topics that that were requested. A difficulty in recruiting new board members because people are not out and about, and people who might be interested in another time frame were not available at this point. My board is, sorry, I'm sorry, I have two screens and it's switching on one screen and not switching on the other screen. So I apologize. You will get a copy of all these slides, but I'm watching on two screens. Those are some training topics that were requested. Anti-racism, DEI, fundraising, leadership, strategic planning, coaching, governance, board 101, and onboarding, and finance for board development. My board is burned out and jumping ship. They are burnt out and we're all struggling with the prospect of many more months of the pandemic. Keeping board members actively engaged. They're being pulled in many directions by employers and family and more, so our emails to board often go unanswered. People have had to resign their positions and recruiting is very difficult. And they're also, it's the same with volunteers. We are volunteer dependent and most are retirees who do not feel safe being back in public. Volunteers aren't as eager to help out, which puts a greater burden on fewer people. Our organization's volunteer culture has been eroding and must be rebuilt. When we couldn't let people inside safely, we didn't have any volunteer labor and 2 staff covered the work 100+ volunteers had helped with before. It's really difficult to attract new volunteers.
So next, we have the results of some questions around finances. And one question we had was, overall, which statement best speaks to your organization's current financial situation? And As you can see, 31% said they were doing well. Another 28.1% said they were struggling. And the others felt like they were through the worst of it. Sorry that percentage is cut off there. We also asked what COVID-19 related funding resources organizations have received. Many of them, as you can see from this slide, received payroll protection, as well as payroll protection 2. And then also, they have also received Rhode Island COVID Relief Fund was the third biggest source of funding that they received.
We asked them what accommodations funders had made with grants and sponsorships. I don't know if you can see the top one. The top one is provided flexibility for events, programs, or deliverables that had to be postponed or canceled was 37%. 36% converted grants to general operating support. Similar numbers for providing new unrestricted or general operating support grants, reducing paperwork, streamlining application process. There was a slightly lower number on flexibility on sponsorship funds to transfer to a different event. And about 21% did not receive any modifications to their grants or sponsorships. I wanted to thank all of you who are part of the 37% who made accommodations for people and recognized that this is a unique time. But I'd also encourage you to think about what you did during this time, and is it possible to continue that? Streamlining the application process, providing general operating support. As we'll talk about, the financial needs are significant, and an overwhelming number of respondents said general operating support instead of programmatic grants would be a significant resource to them moving forward. So it is an opportunity to think about how to make permanent some of the changes that you were great in doing for grantees during the pandemic.
We also asked what financial impact has COVID-19 pandemic had on your organization? And we also wanted to know what their estimation of their lost revenue and increased expenses was over the last 18 months. And we saw that there were, in terms of lost revenue, overall, they had in terms of loss of revenue, they were 23.9% who said that loss was between 15 to 30%. And in terms of increased expenses, actually there were 26.1% that said that they hadn't seen any change. But then there were about 20.7% who said that from 5 to 14% of it was changed. Next slide. We asked if their organization is operating with a budgetary deficit. And actually there were 46% who said that they're not operating at a deficit at this time. And actually there was a smaller percent said yes, 13.4% they are at this time. We also asked, since the onset of COVID-19, which of these financial issues have you had to manage and to what extent? The biggest one was loss of revenue due to cancellation of fundraising events or activities, followed by inadequate staffing or difficulty in recruiting and hiring. Also having additional expenses for program delivery, whether it's having to buy PPE, cleaning, space configurations. That was also problematic. Also, loss of fee for service revenues due to program and event cancellations as well. Those are the major financial issues. I also asked over the past 18 months, which coping strategies have you implemented? There was increased grant writing. There was reports of expansion of services or an addition of new services, development of new collaborations or partnerships, and also intensified individual fundraising appeals was also something that strategies, those are the top strategies used in the last 18 months.
In terms of narrative comments, there were a number of different ways that finances were in jeopardy. One was that the anticipation of relief funds ending. So when emergency funding ends, our program will be in jeopardy once again. The donations for some organizations decreased dramatically. Some benefited from COVID specific relief and philanthropy. And so some organizations did note that they had kind of been cut out of funding because they weren't providing COVID specific relief. And most organizations had an increase in technology and healthcare costs. One noted that many employees came on to the insurance plan or increased from their individual to their family plan due to spouse job interruption. Something we might not be thinking about just in terms of additional expenses, but it does make sense that if a spouse loses the job, then they're going to be on the medical plan of their spouse. All supplies, office cleaning, food, consumables, construction have been marked up ridiculously high. This organization said it decimated our reserves that literally took 20 years to get in place, which is just heartbreaking. A number of organizations talked about how the PPP loans were a really significant backstop for them. And they said that they're really worried now because there's no PPP3 on the horizon. The long-term implications of the pandemic on the populations we serve will still be felt, but the supports will no longer be there. Deferred facilities maintenance, deferral of all but critical discretionary expenses, cost-cutting initiatives to reduce direct costs. There are just references to, again, some of the coping strategies that nonprofits took to stay afloat during this time.
So we also asked participants to what extent they are responding to the racial reckoning that has occurred over in the last year or so. And one thing I just want to point out in terms of this question, it was an open-ended question. There were actually 278 responses to this question, which I found that very interesting. 330 participants altogether, and then 278 who actually responded, with a written response to this particular question in terms of how they are actually trying to respond to either DEI efforts and other racial disparities that are occurring in our communities. And so here are just a couple of quotes that I thought were interesting, kind of highlights what's going on. We are doing an agency-wide training through the organization in racial injustice and equity for all staff. The senior leadership has completed the training, and the management level staff had completed partial training when COVID hit. We are in the process of putting together a virtual training. Others stated, we're working to create partnerships with organizations that work with and advocate for BIPOC communities, hiring more bilingual staff, focus on diversity and board recruitment, planning to hire a community navigator who will focus on making better connections in BIPOC communities. Another response, we have increased the amount of support and trainings along with community conversations in regard to racial injustice issues. However, because of this and the lack of financial support for the services, it has once again put the burden on Black communities and Black organizations to now educate, and non-Black communities and non-Black organizations. Although our input is definitely needed, plenty organizations do not see how they need to financially compensate us for this service. So I highlight these here to say that I feel like those who responded, feel as though, yes, there's definitely a need to focus on DEI, definitely a need to focus in terms of what is your DEI strategy in your organization, in terms of your mission, in terms of strategic planning and so forth. But also there's a sense that, yeah, this work is needed, but then people don't expect to compensate folks to do that work and to make sure that folks are moving along and really working toward a truly, centering racial equity, centering justice work. And I'll just read a couple of other insights. The biggest challenge is our racial justice work. It is fraught and complicated, and addressing these issues transparently in the workplace brings many complex risks, but failing to address the issues is not an option or brings bigger risks. So we are pushing through. Another thing, we would love more assistance and training staff on equity, diversity, and dealing with racial strife. We need training opportunities, especially looking at various topics through an equity, diversity, inclusion, anti-racism lens. So, and I would also say too that I got the gist from, reading through all the comments that organizations, their leaders, they want to do something. It's a matter of how, it's a matter of getting the resources to do so, but then it's also a matter of recognizing that, there needs to be, resources put into actually making that happen and compensating those who are able to give that type of training. Next slide.
So it also came up frequently in the comments about boards. So the training that was being requested is not just for staff, but also DEI training for boards as well. There's a lot on the plate of the nonprofits right now. They are struggling with internal issues. They're struggling with the needs in the community. And we ask them to look forward in terms of what capacity building supports do they need, what do they need to help them be ready for the next crisis. One of the things that they mentioned was the importance of collaboration, and they responded really resoundingly to the idea of having a nonprofit network or association, partially as a place to come together with peers. One of the comments was, "I'm ever so grateful for my colleagues and other leaders who have been a constant network for support. I feel that other leaders have been quick to answer a call or return an email to get through this together. More investment in leadership collaboration would be incredibly valuable across sectors too. Even folks from social service agencies or government have been open to discuss challenges and support each other." And over 70% thought that a nonprofit network or association would be valuable or extremely valuable. We gave a list of different things that could take place at a nonprofit center. Obviously, the opportunity to develop relationships with funders was, and information on funders and funding was front of mind for people because of the financial challenges that they're facing right now. Racial equity and anti-racism training in terms of actual content was the top request at 76%. So again, like Adama was saying, it is front of mind for the nonprofits, and having a hub or a place to provide that training would be really helpful, whether that's through the Rhode Island Foundation's Equity Initiative or other places, would be really helpful. 74% thought that it would be valuable or extremely valuable to have marketing and visibility about the sector and its impact, which I think is key to a lot of these other systemic support in the future, is that the public and government do not necessarily understand the sector and its value. And so there's obviously a real desire to see that story be told, both to prospective donors and funders, as well as in government. Opportunities to develop relationships with policy makers, organizational capacity building and development, support for advocacy, both in terms of policies that would directly impact nonprofits as well as their participants, and a hub for nonprofit collaboration, everything over 70%. So just to let you all know, United Way is helping to develop a process to move that work forward. They put out an RFP for a consultant and are in the process of starting to do interviews for that, to help build a stakeholder process to engage nonprofits across the sector in developing what a nonprofit resource hub could look like. And one of the parts of that process is going to be engaging funders as an advisory cluster. And so we would love to have GCRI members be part of that. We'd also love to have GCRI members help to provide resources in terms of funding to get this work moving forward. So we are going to be having a session to talk more about the nonprofit center, but this was these results and data definitely show that the nonprofit sector is looking for and would value a resource hub of some kind that could really be focused on supporting and advocating for the sector. In terms of professional development, I know some of you offer cohort work with your nonprofits. One of the nonprofits said, when we are fully staffed this fall, more than half of our full-time staff will be brand new and many will be new to this area. Mentorship, networking opportunities, and professional development for new staff and fundraising, marketing, and administration would be valuable. Training opportunities, especially looking at various topics through an EDI anti-racism lens. Board training and development opportunities, especially those that are EDI focused. So some of the topics that were expressed were addressing staff burnout and mental health issues, leadership development for emerging leaders, supervisory skills, succession planning, strategic planning, volunteer management, HR strategies, managing in a remote environment, fundraising and marketing, onboarding staff, board and volunteers, and board training. When we look forward in terms of addressing some of the needs that were articulated about finances, there was repeated calls for essentially what we've been talking about with trust-based philanthropy, simple systems for applying for funding, receiving funds and reporting back, a structure for like-minded nonprofits to partner more easily with funding attached, general operating support so nonprofits can be nimble and use the funding where it's most needed. Eliminating burdensome grant applications. One really significant thing to think about is that in the articulated need around staff support, that is also a testament to the importance of general operating support, because if many times grants that have a lot of stipulations and guidelines do not cover staffing costs, or do not cover staffing costs for those who are not directly working on the grant, even if they are helping in some other way, which perpetuates the starvation cycle for staff. And so understanding how the funders can, even in how they structure existing grants, can help to address some of those pay inequities would be a significant improvement for nonprofits. In the short term, looking to support staff, if there are ways that funders can support respite opportunities, specific workshops, not just on self-care. We had a lot of people say, I don't have time for a self-care workshop, but that are actually respite themselves. So mindfulness workshops, things like that. Funding for salaries and general operating support, gift cards for self-care was mentioned. In terms of long-term staff support, helping to work to increase the pay scale or make possible more of a living wage, helping the state to update their staffing scale, the salary scale. A number of social service nonprofits mentioned that their salary scales were set 6 or 10 years ago in their state contracts, and they have not kept pace with inflation even, and so their state contracts are not paying for the staffing costs anymore. Looking for ways to incorporate staff costs, leadership development, and sabbaticals into the funding that you already do are other options for providing staff support, as well as just reaching out to your grantees and asking them, how are you as an executive director doing, as well as how is your staff doing, and what can we do to support you in this? Because we recognize that this has been an exhausting 18 months. In terms of advocacy and outreach, there is a need for advocacy around the American Rescue Plan funding. A lot of states are doing nonprofit relief funds out of their ARPA dollars, and Rhode Island has not had a conversation about that. In the original CARES Act money, only 2.5 million was allocated for relief for nonprofits. Nonprofits were able to kind of wiggle their way into some of the small business support, but there was no designated funding for nonprofits. So this is an opportunity to look at that, as well as thinking through how nonprofits can be at the table as ARPA decisions are made, to bring their expertise from working on the ground to address systemic issues, as well as how to build a sustainable infrastructure, a civic infrastructure that will sustain the nonprofit sector long term. There's opportunities to advocate in terms of government funding formulas to, again, update the staffing reimbursement. The child tax credit is an existing resource for families, but if families did not make enough money to file taxes last year, they will not automatically get the tax credit. And so those are the lowest income families are the ones who are not automatically receiving the tax credit. The ones who most need it are not getting it automatically. They need to actually apply to receive that. So every single nonprofit that could be trained in that kind of outreach to families means that those resources can go to those families who need it most. So if you, whatever grantees you work with, if you can make sure that they are doing outreach around the child tax credit, that is dollars in the pockets of families in need. Housing, as Christina put in the chat, there's a huge amount of money that is still not being distributed for rent relief. And so as much pressure as we can put on the state to just get that money out to the people we need it, that distribution can alleviate a tremendous potential eviction crisis. And then also advocating for new affordable units, because right now there aren't enough, even if people had the money, there aren't enough affordable places to live. Funders can advocate around equity to make sure that ARPA resources and other resources are directed to affected communities that have disproportionately borne the burden of the pandemic. And look at opportunities to build funding streams for BIPOC organizations. One of the things that a few of us have been talking about is whether there is a potential for a revolving loan fund. For if we are serious about addressing equity in the state, and the state says it does want to address issues of equity, the organizations that are most well positioned to work in those communities are also under-resourced themselves. And so they are not able to access state funding because state funding comes on a reimbursable basis, which means you need to have the cash on hand to do the program and then get reimbursed 6 months later. Most BIPOC-led organizations and grassroots organizations do not have those cash reserves. And so therefore, they are not in the funding pipeline, even though they are the best equipped and have the most trusting relationships in the community. And so we're trying to see if there are strategies that we can do to address them, but one of them that we're talking about is a revolving loan fund that would provide support for the nonprofit to do the program and then be reimbursed with the state grant money. Systems change, what we all know, looking at root causes of these issues so that we're not back in this situation again in a couple of years, and articulating the value of the nonprofit sector to policymakers as well as to the general public. So those would be the recommendations from our initial analysis is general operating support, staff support, particularly in the areas of mental health and trauma-informed training, advocacy, outreach around child tax credit and rental assistance, racial equity support, and then innovation. As these organizations have pivoted and made created new programs and new methods of delivery, and they want to continue to do those things, that requires additional support for those innovative things. Now they may be able to reach a different audience than they were able to reach before, but there's still technology costs, there's still staffing costs, and so supporting those expanded innovations moving forward, as well as the Nonprofit Resource Center. So that was a lot. Adama, do you want to have some final thoughts?
Well, I just wanted to, tell people that in terms of like next steps in terms of analysis, that there is going to be a deeper dive that I'm actually currently taking in terms of looking at, issues around, racial equity and BIPOC leadership. Also, I know that there were quite a few respondents who were in the arts and culture sector, and so want to be able to look a little bit deeper at some of their results, as well as results from those who are in the education space as well. So just want to let people know that we'll be taking an even deeper dive, and I hope to put out some little mini briefs to kind of give some further insight into the results.
So we do have some time if you have questions. obviously this is a initial run through of the information, so we may not have gotten to the particular question that you have, but it would be helpful for us to know what your questions are, even if we don't have the answers for them right now, so that in our deeper dive, we can pull out some of the things that would be useful to you. You can either unmute yourself or you can put in the chat if you have questions.
Hi, it's
Hi,
Carolyn.
Carolyn.
How are you?
Good.
Just a quick question. First of all, thank you both. This is just amazing information to have to really inform our work and our approach moving forward. So appreciate the debrief and access to the information. My question is kind of a nit and goes way back to the beginning of the presentation. And Dama, maybe it's for you, but I'm curious, in the makeup of the survey respondents, you had them classified as a visual depiction of who responded. And not looking at it, I can't remember exactly, but health organizations were a category. And then you had like social service and BH combined. And I was curious if there was some like social science behind putting behavioral health with social service versus in the health category from an analysis standpoint, or if that was just how you did it.
I don't have
Or
the
did
question in
people-
front of me. I think it was just I think it's how that was,
Or did they?
that question. I think that's how it was categorized in terms of the options. And I don't know.
Yeah, there's
Into that.
not a lot of
Just wondering.
thinking behind it, no.
Yeah.
Yeah, the short answer is no.
Okay.
But it's an interesting thing to think about in terms of, I mean, I think that as we were looking at it, we were assuming that there was overlap in terms of, say, the organizations that work, like Tanya Kubis-Meyer's group,
Right.
are working with a lot of behavioral health issues at the same time that they are providing the services, but it may have been confusing in terms of how people self-selected. We also did add, there was one other question that we did ask that we did not include the information because it was, we think that people didn't understand the question judging on the responses, but we had asked, do you think that you have enough funds to provide services for the next 4 months or the next 12 months? We were hoping to get a sense of kind of, are people seeing an impending doom out there on the horizon, or are they feeling more comfortable? But people didn't, the data didn't make sense. So we didn't include that, that question. Someone asked about whether the questions were the same as the last report. We tried to, there were additional questions in this survey. We didn't have in the previous survey, the burnout questions. There wasn't quite as much about kind of what the community need was in the last survey. We tweaked some questions, but a majority of the questions do align with what was in the initial survey. So when I send the follow-up for this session, I will also send you a link to the original report, just so that you, if you're interested, you can look back and just see the differences. But there are additional questions in this survey, and some were tweaked. Is there any plan by United Way or Rhode Island Foundation to press? Yes. So thank you for the reminder, Carol. Carol asked if there's any plan by United Way or Rhode Island Foundation to release the information. We are, next week, we are going to do a webinar for nonprofits. So those who participated in the survey can find out the information. So I will send you all a registration link with that. You can share with your, they should have gotten it in my newsletter, but if they didn't, I want to make sure that everyone can see hear the results. That will also be recorded, so if people can't participate live, they can get that recording. And then we would like to use this to educate the public and policymakers. And so we are going to be working with the PR teams at United Way and Rhode Island Foundation. And we are also trying to come up with a strategy to present it to the governor's office and to the General Assembly. We would love to also, the cities and towns that had a large number of nonprofits respond, we would like to pull out that information to present it to those cities and towns so that they know Newport had 20 something nonprofits. So we can present it to the city council and say, this is a slice of a larger picture, but these are Newport specific results. And anyone who is interested in strategizing either the PR component or the policy component, I would love to hear from you, because I would love to really take advantage of this information at this critical moment when decisions are being made, to be able to push this story both in the public sphere as well as in the policy sphere. So please let me know if you are interested in a brainstorming session about. Are there steps to take now to advocate for nonprofit relief recoveries through ARPA's funding to the state? Right now, I'm still in the process of trying to get the governor's office to pin down for me kind of where we can come into the process. I had an initial conversation with them when before we released the survey, and they were still kind of unclear as to what their process was. But if you would like to be part of that, and you also, if you happen to know some people who are in those spaces, would love to have those contacts and suggestions. Other questions? I just think this is our moment to really make the case for the value of the sector as a whole, and to also say, and one of the things that I want to advocate for is the state looks to the nonprofit sector in a time of crisis, and the nonprofit sector responds at great personal and organizational cost. And the state needs to invest in this sector, or it will not be there the next time they're ready to call on the sector. And so that is a conversation that the state needs to understand. Kate?
Yeah, I think there were 2 points that really stood out to me when you were talking. One is that 75% of respondents said they had started new programs that they did not intend to cease, and only 25% had discontinued programs. So that is really, really compelling. And I wonder if there's you have information on which orgs responded by sector, but maybe there would be an opportunity to even understand that a little bit more. What gaps have been filled that orgs don't see an opportunity to discontinue, and what has been let go, and what's been the impact of that. But thank you again for all your work on this. It's really helpful.
Thanks.
Nancy,
Anything else that you'd like more information on, Carolyn?
just a brainstorm and a conversation offline, maybe with a smaller group, but as we are about to release the 2021 Rhode Island Life Index results, I think Adama and Katie, I'm thinking specifically about the coalition meeting that's upcoming. There, I think there's some consistencies in kind of issue areas or opportunities for improvement, particularly in the realm of programs and services for children and that population. So as we, I guess, maybe from a visibility, but maybe a little bit policy, to the extent we can bring some of that information together. So it's not just, if it just further supports the criticality of the needs identified, not just by the sector who is serving, but also Rhode Islanders, representative of the entirety of the population. So I just wanted to flag that selfishly, mainly because Adama and Katie will be at the coalition meeting and we can maybe brainstorm around how to illuminate some of those points together.
And this is just an informal suggestion as well. One of you had asked about the ARPA on-ramp right now, but I just want to also throw out that the rent relief piece, as much as we can highlight both getting the word out to communities about the availability of the rent relief, as well as the importance on the government side of getting that money out, the more attention that's placed on that money is there. It doesn't need to be advocated for. It just needs to get out. And so I think the more people who are cognizant of that, who are talking about that, who are, if you happen to talk to someone in the governor's office or in the legislature to say, can you tell me an update? Just so that they know that people are paying attention and that money really needs to get out to the people who need it. Chris, you want to say anything about that? Chris Brown? You might not be at her desk. Anything else?
I just wanted to add, NeighborWorks in Massachusetts last Friday had an event on the whole rental assistance and getting people in and filling out the applications to do that. So maybe NeighborWorks in Rhode Island could similarly do something like that.
Yeah, I think that is something for all of your grantees to think about, whether they hold an outreach event, bring someone from Rhode Island Housing who can help people walk it through, but do it in a familiar space. So at the community center, both for rent relief and child tax credit, if you have grantees, even if they are not basic needs grantees, they are still community anchors in some way. And they reach a population that other nonprofits aren't going to reach. And so if it's front of mind for every nonprofit, whether they're a humanities nonprofit or a arts nonprofit or a basic needs nonprofit, then the opportunity to get those relief dollars out. Again, it's not money that we need to advocate to be allocated. It's just that needs to, that people need to be connected to those existing resources. Okay, well, if you do think of other questions that would be helpful, please email Adama and me. Really email Adama because she's the expert and I don't slice and dice. Adama slices and dices. So thank you so much. And if you are interested in the PR conversation and the policy conversation, please reach out to me. We had a couple of United Way PR folks on the call, and thank you, Faye also volunteered to help too. So if there are others who are interested in that, please reach out to me. Thank you. Have a good afternoon.